70% of people who have a diagnosis of schizophrenia improve or get significantly better. Warner was a great one to talk about the political environment, and in his book there's a great deal of graphs that show that the recovery rate was linked with the economy at the time. So if the economy was depressed, then the recovery rate was lower. If the economy was better, then the recovery rate was better. And so Warner put a lot of emphasis on that, the economic side of recovery, very much saying that if the economy is depressed, then people aren't willing to hand over money as readily to mental health services. They're also more guarded about, people in general, that is the community, are more guarded about who has the jobs and who has a right to a job, whereas if times are good, then people are more generous and more likely to be giving and wanting things. So they're the sorts of things that he talks about. And clearly a conclusion of that is that adequate psychosocial care is all important, as opposed to, although drug therapy is important, it's only a very, very small part. Prognostic indicators. If you look at what the literature also says about, okay, how do you know if someone's going to have a good prognostic outcome? And there's always prognosis everywhere. I mean, we like using that term. I think it helps us feel better. I don't know. It's pretty catastrophic in many cases, if you're on the receiving end of it, from what we've heard anyway. Traditionally, what people have said, you are more likely to have a good prognosis with if you have a diagnosis of schizophrenia, if you have a sudden onset, if it occurs later in life, and if you had good pre-morbid functioning. So they're traditionally what people have said lead to good prognosis. However, the symptoms and clinical features have very little value for predicting outcome in reality. And it does appear that good functioning in one area will return. It must be said that the ability to predict outcome is not high. And those prognostic indicators, I think you'll see from our research, have been significantly challenged, or are significantly challenged. What we set up to do with our research was we asked people about all these sorts of things. So we had a profile of what the literature says about good prognostic indicators, but we asked that at the end of our qualitative interview, so that we didn't contaminate what people were telling us with these sorts of things. We wanted to keep it very much these things at the end, but we do have that data so that we can make some comments about our sample who consider themselves to be in recovery. We've already spoken about some of the methodological issues. And look at some of the other research that is known, and certainly this is besides what Warner has done. It can be seen that chronicity is a result of the way people are treated, and certainly Anthony talks a lot about that. Strauss talks about improvement rather than recovery. So he has been the other leader in the research on consumer recovery. And although he used to use the term recovery, he finds that it's now no longer a useful term to use, and he prefers to use the term improvement. For Strauss, he also talks about what Kraepelin and Bleuler said, the essential core of schizophrenia being a person's loss of will and disintegration of the personality. Now he actually agrees with that and thinks that that is what happens, but he thinks that our efforts to date in understanding that have been quite poor, that we haven't really understood the human functioning of what that means, and we haven't really looked at the healing processes. And that our attempts to understand this essential core, if you like, has really been lended towards simplistic explanations, like we talk about in prognostic terms, or we talk about in medical terms or whatever. He thinks that we have really been too simplistic in that regard. Probably Anthony has a lot to say about what the system has done to people with mental health problems. And he talks a lot about recovery being the same from a mental illness as it is for any other illness, that you have to recover from the impact of the illness, you know, rather than the illness per se. He has some basic assumptions of recovery. And he talks about that in terms of the mental health system, which I think is really important for us to take note of. And he also says that the process of recovery from schizophrenia has not really been studied, which is one of the reasons why we embarked on this study. First one that he talks about is that recovery can occur without professional intervention. And if you think about the studies that, you know, Carly cited this morning that about India, and that, you know, that professional, you know, some people do better if they don't have any contact with health professionals. And Strauss also talks about people who that actually recover are the ones who've had the sense to get out of the system and not have anything to do with us. So Strauss talks about smart consumers, if you like, and that is those who are smart enough to know that if they want to get better or recover, then they stay as far away from us as they possibly can. And Strauss really, you know, he talks about it in those terms. And Anthony agrees with that. So certainly recovery can occur without professional intervention. Also, what Anthony talks about in this other research is that a common denominator of recovery is the presence of a person who believes in the person and stands by the person in their time of need. And that seems to be a pretty common and consistent theme, that it's for people to recover, it's really important for them to have someone there with them who does believe in them during that time, and that does not have to be a health professional. He also says that recovery is not a function of one's theory about the causes of mental illness, so that it doesn't matter whether you have a biological view, whether you have a psychological view or a predominantly social view, that you can still recover regardless of, you know, wherever you're coming from, so that you might have one bias towards understanding a particular illness, but that doesn't mean to say that a person can't recover. So he also thinks that recovery can occur even though symptoms reoccur, and that's a pretty important notion, that we tend to think of people who are recovering